Welcome to this episode of Substantial Matters, Life and Science of Parkinson's. I'm your host, Dan Keller. At the Parkinson's Foundation, we want all people with Parkinson's and their families to get the care and support they need. Better care starts with better research and leads to better lives. In this podcast series, we highlight the fruits of that research, the treatments and techniques that can help you live a better life now, as well as research that can bring a better tomorrow. When someone with Parkinson's disease is admitted to the hospital, even a planned stay can feel overwhelming and stressful. Of the more than 1 million people living with PD in the U.S., nearly one-third are hospitalized each year. Recognizing the challenges of hospitalization, the Parkinson's Foundation developed the Hospital Care Initiative with the goal of eliminating preventable harm and promoting higher quality care for people with Parkinson's. For this episode, I spoke with two people involved in making hospitalization safer for people with Parkinson's. Leslie Pelton, a senior program officer at the John A. Hartford Foundation, has been a leader in the Age-Friendly program and works directly with hospitals and health systems to help implement practices that facilitate better care for older patients. Central to the program are the 4 M's: what matters most to a patient, their medications, their mentation or thinking, and their mobility. My second guest, Rebecca Miller, is an associate professor of psychiatry at the Yale School of Medicine. She lives with young-onset Parkinson's and brings her expertise as a clinician and active participant in the Parkinson's Foundation's Learning Collaborative. I started the conversation by asking about her hospital experience.
I was diagnosed in 2013 and didn't have to have any experiences with the hospital until I had appendicitis. I had to have my appendix removed on an emergency basis in 2019. And I had heard vaguely of problems people with Parkinson's had in the hospital, and I sort of arrogantly thought, I'll be fine. I'm younger, I'm well educated, that won't happen to me. But then when I got into the hospital, I had all the kind of typical problems that people with Parkinson's experience. I didn't get my medications on time. I got the wrong medications. I got medications that were contraindicated. So all those things, or at least some of the things that happened to people with Parkinson's in the hospital, ended up happening to me. So that really motivated me to write a letter to the hospital and start getting involved in advocacy work, particularly with the Parkinson's Foundation, which is really ahead of the pack in terms of the work they're doing around people with Parkinson's and the hospital.
Were you at Yale New Haven Hospital?
I was actually, yeah.
That's quite something to say that even a major institution like that, very well regarded, and you still had problems.
It's shocking, but it happens in all hospitals. And I think that really people with Parkinson's end up highlighting the structures within hospitals that have problems in general, like medications and nursing shortages, things like that. But we end up really being the most harmed, I think, because of our particular needs. And it ends up becoming a real problem. I mean, I can give you some statistics. For example, 3 out of 4 people in the hospital end up not receiving their meds on time. And this can have a really severe impact on people, leading to increases in morbidity and mortality, which is a fancy way of saying we get hurt more and we end up dead more often, which is not good. So really making changes to the hospital system is really a great importance.
It sounds like your own personal experience navigating the hospital as someone living with Parkinson's motivated you or opened your eyes, and now you're part of the clinical team from Yale New Haven Health System that participates in the Parkinson's Foundation Hospital Care Learning Collaborative. So what exactly is the Learning Collaborative, and what have you observed at your hospital since it joined?
Yeah, so I was lucky enough to find great partners at the hospital who are really invested in changing those systems and through that, we connected with the Parkinson Foundation Learning Collaborative, which is really an opportunity for people from different hospitals across the country to come together, brainstorm, share ideas, listen to ways to kind of how to transform our systems and make sure that they're more geared towards caring for people with Parkinson's in the hospital. So one major step that our hospital has taken is really identifying those people with Parkinson's through their electronic medical records and then making sure that there's an alert that comes up if they're being prescribed a medication called haloperidol, which is, it sounds very technical, but it's really important because this medication is something that decreases dopamine. And as we know, that's not what you want for someone with Parkinson's. It is one that gets prescribed fairly often for things like agitation or delirium that can happen to older people when they are in the hospital. So it actually is, fairly frequently prescribed for people with Parkinson's. It can lead to a whole host of other problems. So just being able to identify those people who do have Parkinson's and making sure an alert comes up is a major step. Even though it sounds simple, it requires lots of coordination and different kind of areas of the hospital working together to change their system. So that's been really exciting to see and has been a benefit for Yale since joining the collaborative.
Is this all part of the Parkinson's Foundation's hospital care recommendations?
It is. So from the patient's perspective, there's this great booklet called the Hospital Safety Guide that's available on the Parkinson's Foundation website. They'll send you a free copy. And I've used it in my more recent hospitalizations for DBS surgery, because even on the neurology floor, at times, medications have been prescribed that are contraindicated. So that's been really helpful for me. So that's on the patient side. On the hospital side, the hospital care recommendations are really these great sets of recommendations that the hospitals are working towards. The Parkinson's Foundation and their collaborators have come up with that detail what needs to change in hospitals to make care more safe for people with Parkinson's.
So it sounds also like it's pretty good to have the patient perspective on developing these sorts of recommendations, guidelines.
Providing the patient story can really ground those recommendations in someone's real story. And we as humans remember narratives and stories much more than specific details, et cetera, that if you have someone there saying, listen, this is what happened to me, it can make a big difference. And I found that to really be true with the group that I'm working with, that they really value my voice and my story.
I think there's more and more attention these days on what are called special populations. They might be large populations, but they have their own sort of characteristic needs. So, Leslie, I understand there's been tremendous momentum with the age-friendly movement, and today there are more than 5,700 age-friendly health systems in the U.S. Can you tell us what it means for a hospital to be age-friendly?
An age-friendly hospital and actually an age-friendly practice or a home health care agency or nursing home is reliably practicing what we call the 4Ms, which is a set of clinical interventions, starting with the first one being what matters, understanding the goals of care, understanding, as Rebecca said, allowing space for the patient's voice in their care. The second of the 4Ms is medication, so making sure that if and when medications are prescribed, they don't interfere with what matters to the older adult. The third M is mentation, so the health of the mind. So making sure that in the hospital, delirium is prevented, that it's recognized and addressed when it happens. In the community, making sure that we understand when somebody might be experiencing cognitive impairment or depression and making sure that's addressed. And then the fourth of the 4Ms is mobility, making sure that the person can act on and move in their life every day in a way that allows them to attend to what matters to them. The 4Ms individually, there's nothing innovative about each of the 4Ms. What's different about an age-friendly hospital or place of care is that they're committed to reliably practicing that set of the 4Ms, what matters, medication, mentation, and mobility. And you mentioned, Daniel, that there's more than 57 sites of care right now that are recognized as age-friendly. And I just want to say it's been incredible momentum. There's been incredible uptake of the 4Ms. And we understand that really they built on what's always existed, which is committed physicians and nurses and administrators across the country who want to reduce harms, who want to deliver evidence-based care, who want to deliver care that's centered on what matters to people. And the 4Ms were really handed to so many of these care teams and said, here's a way that you can do that. And that's why, in many ways, I think that it's taken off the way that it has. There's one other aspect of being age-friendly that I want to mention, because Rebecca, you started to allude to it a little bit, which is not just bringing Rebecca's voice and the voice of the patient into the care, but also the voice of the family and the family caregivers and other caregivers, other people who matter in our lives, and making sure that they are a part of the conversation, that when the patient either can't speak for themselves or is having a harder time speaking for themselves, that the family caregiver is there and present in the conversation so that they can amplify what's important to the patient.
Do you have an estimate of how many people may be impacted, older adults, with the 4Ms that you've outlined?
As of now, I think a conservative estimate that we've calculated is 5.8 million older adults care has included the 4Ms and has integrated the 4Ms.
You and several other co-authors of the Parkinson's Foundation and members of the Learning Collaborative have recently published an article highlighting how the Parkinson's Foundation hospital care standards and the age-friendly 4Ms framework are aligned with each other. So can you talk a little bit about how the 4Ms are specifically relevant and beneficial for a person with Parkinson's in the hospital?
Yes, the Johnny Hartford Foundation, we were so pleased when the Parkinson's Foundation approached us about having this conversation, about publishing this article, about meeting Rebecca and having this conversation, because as Rebecca said, older adults and other people with serious illness, even very well-regarded hospitals with exceptionally well-trained physicians and nurses, are often constrained by the system in which they practice, and harms happen to older adults and people with serious illness, because we know people at that point in life and people with serious illness require a coordinated aspect of their care to happen for them to stay well. And we know that health systems are not designed as they are today for that coordination to take place. And the 4Ms are a coordinating framework. They're also a language that can be used across an entire hospital and across an entire experience that a person with a serious illness might have, and a common language to happen throughout that person's care. So we see the 4Ms as incredibly relevant for people with serious illness because of the similar needs that they might have and similar experiences they might have in our health system as it currently exists, and the 4Ms being really an alternative to the way care is often currently provided.
Rebecca, can you predict how your hospital stay might have been different if the 4Ms had been applied to your care?
Yeah, I mean, one thing that I want to emphasize too is, as Leslie said, this is not a case of bad apples. This is not a case of nurses and doctors not wanting to do the right thing, but oftentimes the system isn't organized in ways that really supports them doing that. So, for example, with medication, I had gotten my own medication from home and wanted to take it, but it took so long for it to get checked in and approved that it wasn't available for a day. So that meant that I missed doses of my medication. So things like that are examples of, with the 4Ms being applied, I think that would have improved my experience in the hospital. And as a disease of premature aging, I often feel like I can relate to older people, even though I'm only in my 50s at this point. But the 4M, I see it as generally moving the systems towards being more person-centered overall. And that's particularly important for older adults, particularly important for people with chronic illness, but ultimately will be helpful for everyone in the hospital.
It sounds like the 4Ms, or at least the medication part, fit in with the mantra that has always been said about a person with Parkinson's being hospitalized: right medication on time, every time.
For sure.
Rebecca, you talked so eloquently about ensuring that the hospital addresses the medication needs of a person with Parkinson's when they show up in the hospital. And I wanted to add to that about the importance also of the hospital pausing and asking what matters, right? You're asking them to apply evidence-based care around medication, but we also would ask that for mentation, mobility. And we also would say pause and ask what matters. When the person with Parkinson's disease, what we have hypothesized when they show up in the emergency department in the hospital, if we stop and ask what matters to them, Parkinson's is probably going to come up and their medications are probably going to come up. So we have to pause and ask that question. There's a study that came out of Northwell Health that showed that when we pause and ask what matters in the emergency room and then emergency care, the length of stay, if the person is admitted, the length of stay is actually shorter. The sooner the question is asked, the closer the question of what matters is asked to the person arriving in the emergency department, the greater reduction in the length of stay if they're admitted to the hospital. And I think there's a lot of relevance for that for people with Parkinson's. And I hate to put the onus on people with Parkinson's disease to say, stop, let's tell you what matters to me. But I think that is an opportunity. And I think we should also, through our patient and family advisory councils and other opportunities, be demanding that the hospital have practices in place where that is stopped and asked for.
It's so true, Leslie, because really what matters to me, the four M's in a way intertwine. Because what matters to me is movement. That is facilitated by my medication. So that's always on my mind.
I love you saying that, Rebecca, because each of the four M's are not innovative of themselves. It's the set because of the way that they interact with each other, right? I imagine if your medications are not right, you can't move in the way that matters to you. You can't be mobile in a way that matters to you. And if we don't stop and ask what matters, there may be a greater delay in you receiving the medications that you need, which then there's going to affect your mobility and of course going to affect your mentation. So thank you for raising that up because that is the point and also the opportunity for hospitals to deliver great care that I know they want to deliver.
Can both of you comment on what people with Parkinson's and their care partners can do to advocate for safer Parkinson's and age-friendly care in the hospital?
One thing you can do is if you know that you are going to be in the hospital, if you have a planned hospital stay, you can get in touch with the patient advocate or others in the hospital to try and plan out how you're going to make sure that your medications are there and on time, et cetera. I think the Parkinson Foundation Hospital Safety Guide, which I mentioned earlier, is such a great resource. They have a little removable list of contraindicated medications that are okay, gives really detailed instructions on how to talk to nurses and doctors about Parkinson's for you as the person with Parkinson's and for your family and caregivers, and just really provides a wealth of information to help you plan ahead.
Leslie, I understand hospitals now are responsible for reporting to the Centers for Medicare and Medicaid Services on the new age-friendly measure. What have you observed in terms of implementation of the 4Ms into patient care already?
Well, because the Center for Medicare and Medicaid Services, CMS, regulates hospitals and pays, they're the largest payer for many hospitals, they have a lot of influence and impact on how care is delivered. That is to say, what CMS says gets the attention of hospitals. And because CMS now has a measure that requires hospitals to report on how they're practicing the 4Ms, it's increasing the interest of hospitals. It's accelerating the rate of adoption of the 4Ms in hospitals. So from our perspective, because the 4Ms is associated with safer care, with better outcomes, that is a really positive step. The other piece is that the information about how a hospital reports on their own practice of the 4Ms is available to be seen by the public through CMS's website called Care Compare. so they can see what hospitals say about whether or not they're practicing each of the 4 M's. So it gives, in that wonderful planning that you talked about, Rebecca, with your hospital safety guide, person, their family would have the opportunity to look and see which hospital in their area is practicing the 4 M's and make a choice maybe about where they go and get their care. I will also say a nice compendium to the hospital safety guide that you talked about, Rebecca, which sounds so critical for people with Parkinson's, is a guide called My Health Checklist, which is really a worksheet for people to identify for themselves care around the 4 M's. So it starts with an opportunity for a person to articulate and literally write down on a piece of paper what matters to them, what their medications are, about their mood and the health of their mind, and about how they want to move every day to be able to act on what matters. So that would be a great compendium with the hospital safety guide to have on the ready for when a person might have to go into the hospital.
One way to get involved really with your local hospital, which oftentimes there aren't that many hospitals around and you don't have as much of a choice as you'd hope for, but a lot of hospitals these days have patient and family advisory boards that can be really helpful to get involved with, and that they sometimes have specialty specific boards like focused on neurology, etc. And that can be a way to really help bring the voice of you and others and your family members with Parkinson's to the hospital and help them make the changes that you need to see for the hospital to be safer for everyone.
It's such a great idea, Rebecca, and we call them PFACs often, right? For the patient and family advisory committees can have a lot of impact on whether a hospital pursues becoming age-friendly. And the Johnny Hartford Foundation, for anybody who's listening, who's part of a patient and family advisory committee, you can tell your hospital that they can join the age-friendly health systems movement at no additional cost to them. It's all underwritten by the Johnny Hartford Foundation. So tremendous support that's available to your local hospital to work on adopting the 4 M's. And so I love your idea, Rebecca, of that being a place for people to speak up and encourage, and here's an action that they can take.
Based on the benefits that you've seen already from the hospital safety guide and the 4M's framework, can each of you sort of predict or speculate on what you hope to see in the future if more hospitals participate in the Parkinson's Foundation's Learning Collaborative and more specifically adopt both the Foundation's hospital care standards and the age-friendly 4M's framework?
We see all people, and especially older adults and people with serious illness, being able to come into the hospital, having fewer harms, safely receiving care that is centered on what matters to them, and being able to leave the hospital sooner and being more healthy when they do than many older adults and people with serious illness are now.
Yeah, I would say that in some ways that people with Parkinson's are the canaries in the coal mine for the hospital system. The hospital systems are starting to recognize and starting to shift in big ways towards being more person-centered, being more focused on what's important, what matters to the person. And that I hope that people with Parkinson's will receive the best care, but that really that hospitals are a safer place in general for all people going to them.
In an emergency, someone's going to go to the closest hospital, but if they can plan an elective surgery or something, how can they get a fix on the hospitals in their area and which ones might be best for them in light of their Parkinson's disease?
I would say to go on CMS's Care Compare website and look and see which hospitals in their area are practicing the 4M's as a proxy or an assurance that the care that they receive there will be aligned with what they need.
To whom should they be directing their comments about what's important to them? When you go into the hospital, it's kind of a flurry of staff coming and going. Who's going to listen? Who's going to take it to heart?
I mean, it seems like in some ways you need to do it with every new nurse, every new shift.
Yes.
That there's a lot of people that you need to talk to about it. But I think generally my experience would be that sort of the intake questions, hopefully it will make it into the chart and then be reviewed or looked at by other staff members. Leslie, what would you say for that one?
I completely agree. I was hoping that you might say something different, but in my experience with age-friendly health systems, it's every single encounter that you have, every single encounter. And that is exhausting, which is why the Institute for Healthcare Improvement and the Johnny Hartford Foundation created the My Health Checklist. So you can have a literal printout to say, here, let me point you to these 3 sentences I wrote. This is what matters. Stop and look at this.
Sounds like there needs to be a big flashing red box in the electronic health record that pops up before anything else to say, think of this stuff.
You are so right. Yes, yes. And it is happening, by the way. That is being built.
So thanks a lot. I appreciate all the time and the information. Take care. Both Leslie and Rebecca shared great resources like the 4M's worksheet and My Health Checklist, to which we'll include links in the show notes. To read more about how to prepare for a hospital stay, whether planned or unplanned, visit parkinson.org/hospital stay. There you'll also be able to download a copy of the Parkinson's Foundation's Hospital Safety Guide. As always, our PD Helpline information specialist can answer questions and provide information in English or Spanish about this topic or anything else having to do with Parkinson's. You can reach them at 1-800-4PD-INFO. If you'd like to leave feedback on this episode or to let us know what other topics you'd like us to cover, visit parkinson.org/feedback. Be sure to subscribe and rate us on Apple Podcasts or wherever you get your podcasts. At the Parkinson's Foundation, our mission is to help every person diagnosed with Parkinson's live the best possible life today. To that end, we'll be bringing you a new episode in this podcast series every month. Till then, for more information and resources, visit parkinson.org or call our toll-free helpline at 1-800-4PD-INFO. That's 1-800-473-4636. Thank you for listening.